Dear chairs, dear colleagues, I would like to present my thesis topic, the novel treatment approaches in penile cancer. My name is Judit Vargha. I'm a urologist and andrologist, and I work in the Semmelweis University in the Department of Urology. My mission is searching for a more effective therapy for advanced penile cancer patients, therefore improving their life expectancy with penile cancer patients. We got three projects which related to penile cancer. The first one is comparing efficacy and safety of immunotherapy with chemotherapy in penile cancer patients. It's a meta-analysis started at September. The second one is investigating the effectiveness and safety of penile cancer immunotherapy versus chemotherapy. The penile study, it will be an international survey. The third one is to investigate the reasons for prolonged denial in patients with penile cancer. My first topic is comparing efficacy and safety of immunotherapy with chemotherapy in penile cancer patients. About my background, I like to highlight penile cancer is a very real disease and it's very aggressive. The worldwide incidence is low, but if we check the undeveloped countries, it's very high. It's due to sexual behavior and poor hygienic conditions. The 5-year survival is 67%, but if we look separately localized and advanced cases, we can see a big difference. And unfortunately, most of the patients seek medical advice late when the tumor is in an advanced stadium. For these patients, therapy after surgery is chemotherapy, but even with chemotherapy, the survival is very poor. We know more than 95% of penile cancers are squamous cell carcinoma, and half of them express PD-L1. It provides further therapeutic options in the future. And these therapeutic options in dermatology has been exploited. They use immunotherapy as a first-line treatment in skin squamous cell carcinoma, the same tissue type, but in other localization. So we like to investigate the effectiveness of immunotherapy in penile cancer. Our clinical question, is immunotherapy more effective and safer than chemotherapy in penile cancer patients? Our study population is penile cancer patients. We like to compare immunotherapy with chemotherapy, and we're interested in efficacy and side effects. And our hypothesis is immunotherapy is more effective and safe compared to chemotherapy. And with our first study, we would like to implicate immunotherapy into daily practice in penile cancer patients to improve their quality of life and prolong survival. We performed a systematic search in 3 databases. We found more than 400,000 articles. And in the search key, the first domain is about the condition, penile cancer and squamous cell carcinoma, and the second domain is about the therapy, immune checkpoint inhibitor therapy and chemotherapy. With the search key, we find very good K articles, and about the regarding the K articles, I like to highlight 2 important things. The first one is we work with very low number of patients because immunotherapy is not evidence-based therapy and penile cancer is a real disease. And the second one, we didn't find any article which compared immunotherapy with chemotherapy. So in the end, we will do an indirect comparison. In this diagram, you can see our progress with the first topic. After the duplicate removal, we got 3,059 articles, and 2,013 articles remained after title and abstract selection with Cohen's kappa 0.93. Currently, we are in the full text selection phase with our first topic. We started this in this Monday. My second topic is investigating the effectiveness and safety of penile cancer immunotherapy versus chemotherapy. We call it penile study. It will be an international survey. The background is nearly the same as the first one, and I like to highlight in advanced penile cancer, the chemotherapy is not an effective treatment, the survival is very poor, and in the guideline, the gold standard therapy is chemotherapy, and immunotherapy, they're inside the guideline, but with a very low level of evidence, and with just promising early data. And as I mentioned, dermatologists used immune checkpoint inhibitor therapy as a first line. In 1998, they performed a study. They used semiplimab as a first-line therapy in squamous cell carcinoma, and after the second phase of the study, they stopped it because of ethical considerations, because immune checkpoint inhibitor therapy was more effective than chemotherapy. So our idea is we started to treat penile cancer patients with semiplimab as a first-line treatment after an individual treatment permission, and our experience is very good. And we like to collect all the cases where they use immunotherapy as a first-line treatment in penile cancer, and after making an analysis about that. So our aim is investigating the effectiveness of immunotherapy in penile cancer. Our clinical question: is immune checkpoint inhibitor therapy effective and safe in penile cancer as first-line therapy? Our population is advanced penile cancer patients, and we like to compare immune checkpoint inhibitor therapy with chemotherapy, and we are interested in survival and side effects. And our hypothesis is immune checkpoint therapy are effective and safe than chemotherapy in penile cancer, and our clinical implication is introducing immunotherapy as a first-line treatment for penile cancer patients to improve quality of life and prolong survival. Summarizing my topics, with the first two we started them and we want to submit in the next year, and the third one we like to start in the next year, and the year after we like to submit it. And I like to thank you for your attention with a quote from Terry Pratchett: "It doesn't stop being magic just because you know how it's works."
So, congratulations, that was a nice presentation. Do we have any Hungarian experience regarding immunotherapy in penile cancers?
Yes, we started this therapy 2 years ago in our department. And we got good experience with it, but statistically we don't check. And we know in the Hungarian Oncological Institute, they use the same therapy, the semiplimab therapy as a first-line treatment.
But we don't have any Hungarian publications until today?
No, not yet. The first idea was just collect the Hungarian cases, and after publicate that, but in the end it's growing an international survey.
In number, how many cases are there in immunotherapy?
We got 11 cases. In the Oncology Institute, they got 15 cases maybe, so it's a very high number of patients in this disease.
My question is a general question about what do you think about centralization for this type or rare type of cancer, because as we see in our daily practice, so it's very difficult to treat cancer type.
Yes, thank you. Yes, every real cancer disease have to treat it in centrums. In Hungary, there's only 40 or 50 cases per year. And you have to got a very good practice about the disease, the surgical treatment, and after the chemotherapy, the irradiation. And in the literature, we found many articles which compare the local therapy in the local hospital and in the centrums. And in the centrums, the survival is higher.
As I understand, the immunotherapy is already a well-established approach in the field of dermatology. Am I right?
Yes.
Okay, but still not in urology. So, and I also suppose that there are a lot of studies in dermatology which, already confirm the beneficial effect of immunotherapy. Why do you think that in penile cancer the result is not the same? I mean, the cell type is basically the same. Is there any influential factor that can, somehow alter the effect compared to the dermatology findings?
Yes, it's the same tissue type, the same carcinoma, but other localization. And everywhere in the world, skin cancer treated by dermatologist and penile cancer treated by urologist. And if still we haven't got the evidence from the studies, the therapy won't go inside the guideline. So I think it will be the same.
So in the background, maybe, or as a reason, the lower incidence of penile cancer, maybe just because probably there is a reason why, for example, there is no recommendation in the guidelines regarding the immunotherapy. So maybe it can,
yes, maybe.
It can be because of the lower incidences, maybe. And my other, maybe not question, just comment in your third topic. You mentioned as an outcome, of course, the most hardest outcome, the survival. But probably you want to investigate the overall efficacy. And maybe not only the survival should be included, but for example, the recurrences or the need for surgery or something like that. Probably this project is just a planned project, and in a preliminary phase, you will go into the details. I just wanted to highlight that, of course, especially in a registry analysis, you can find several other outcomes when investigating efficacy or effectiveness, and not only the survival.
So we have to note that you saw this high incidence of the advanced penile cancers at the time of the diagnosis. That means the relatively low number of cases, but there are a big portion of the cases misdiagnosed. And that it means the late diagnosis. That's why these publications and these studies should have also a part for the education, because the prevention that would be really important, and the early diagnosis. When there is an early diagnosis, then you can perform surgery as a partial resection of the penis, or a part of a penis only. But in advanced cases, we have to do the amputation, and then the immunotherapy, or partial amputations and chemotherapy and so on. And you saw that's a very strong disease when it's in advanced stage.
Just one comment. You thought that basically it's true worldwide that the penile cancer is treated in urology centers and not dermatology centers. But I'm just wondering, because the dermatology screening is getting more and more popular. But for example, the urology screening, I'm not sure that it really focuses on the dermatology part. So it's just an idea, a theoretical idea that, for example, in case of general dermatology screening, what if, for example, the dermatologist would also check the penile and not only the other parts of the body? Because I'm pretty sure that more people will present at the dermatology visit just for a checkup and not because of penile checkup. Just an idea of how to say.